Hi all, I'm Dr. Malati, Local Professor in Technology. In this video, I'm going to discuss about the placental abnormalities. The objectives are introduction, definition, types, variations of placenta, summary, conclusion, and references. Introduction. The placenta is a temporary organ that develops during pregnancy and plays a vital role in supplying the oxygen as well as the nutrients to the fetus while growing the waste products. Placental abnormalities refer to conditions in which the placenta develops, it attaches, functions, and separates abnormally. So these conditions can lead to a serious maternal and fetal complications such as bleeding, fetal growth restrictions, preterm birth, and even fetal death if it is not recognized and managed properly. Nurses plays a vital role here in early identification, continuous monitoring, patient education, and providing the appropriate maternal and neonatal care. So this is a term placenta, which depicts both the fetal and the maternal side, and it is considered as a normal placenta. Definition. The placental abnormalities are any structural, functional or positional disorders of the placenta that interfere with its normal development or function during the pregnancy is called as a placental abnormality. So these abnormalities, it can reduce the placental ability to provide the adequate oxygen and nutrients to the fetus, and also it may causes complications for the mother, leading to the adverse maternal and the fetal outcomes. Types of abnormal placenta are: placenta are larger and heavier, smaller and lighter, syphilitic placenta, edematous placenta, succingerate placenta, pachydoor placenta, velamentous placenta, infarcted placenta, tumor in the placenta, hematoma of placenta, placental spuria, placental cyst, placenta extracoriolis, which includes two types, circumvallate placenta and marginata placenta, placenta membranica, lobulated placenta includes two types, bipartite and tripartite, then creta, it consists of three types, that is placenta accreta, placenta increta, and placenta perforata. Next, we will discuss about the variations of placenta. So, I have discussed about the normal placenta in my previous video. Now, we will check on to the variations of placenta. First is a larger and heavier placenta. So, this is here the placenta will be larger and heavier than the normal placenta. So, as we all know, the normal placenta weight is only 500 grams. So, here it will be little more larger and heavier. Smaller and lighter placenta is considered as less than the normal placenta is considered as a smaller and lighter placenta. Next is syphilitic placenta. It is abnormally large, pale, yellow, grey in color. The placenta will be grey in color. Then edematous placenta, it looks like mushy, thick, pale, and fluid can be squeezed from it. Placenta succingerate, which is nothing but presence of one or more small lobes of the placenta. The size of the cotyledons is placed at varying distance from the main placental margin. And also here each lobe will be having a communicating blood vessels. Next is the placenta spuria. It is same like a succingerate placenta. Here the difference is here it does not have a communicating blood vessels. Otherwise, here also there will be a presence of one or more small lobes of placenta and the size of the cotyledons placed at varying distance from the main placental margin. Next type is placental extracoriolis, which is nothing but presence of thick ring on the fetal surface of the placenta, so that it gives the impressions like central portion is somewhat depressed. Here it is dividing into two types. One is circumvallate, another one is marginata. Circumvallata, which is nothing but a white ring which is situated at the variable distance between the margin and the center of the placenta. Marginata, which is nothing but the white ring is located at the margin of the placenta. So this is the difference between the circumambulata and marginata. Next is lobulated placenta. Here the presence of multiple placenta or one placenta is divided into two or more parts, either completely separated or joined for a single fetus. So here also it divides into two main types. One is bipartite, another one is tripartite. So in the name itself we can able to understand bipartite, which is nothing but two divisions which is present in the placenta, and in the tripartite three divisions will be present in the placenta. Next type is a battledore placenta. Here the umbilical cord is inserted at the margin of the placenta. Next type is a velamentous placenta. Here the umbilical cord is inserted into membranes at the varying distance from the placenta. Next is infarcted placenta. Infarction of cotyledons of the placenta happens due to the reduced blood supply. Next, presence of tumor in the placenta. Hematoma of placenta, which is nothing but collection of blood which may lead to presence of a big hematoma in the placenta. Next type is a cyst of placenta, which is nothing but presence of cyst in the placenta. Next is placenta creta. Here the placenta inchoates beyond the level of decidua. So decidua is the name given to the endometrium after the implantation of the zygote. So here mostly due to the absence of metabolic membrane, based on the depth of the invasion, it is dividing into three types. That is placenta accreta, placenta increta and placenta procreta. So placenta accreta, which is nothing but the placenta get attaches to the uterine wall but not too deeply to the myometrium. In placenta increta, the placenta attaches too deeply to the myometrium. Whereas in the placenta procreta, placenta not only attaches too deeply but also it invades the other organ like bladder. Next is placenta membranica. Here the placenta is unduly large and thin in nature. Next, placenta previa. Here the placenta is implanted partially or completely over the lower uterine segment or to the adjacent or to near to the internal os. Summary. The placental abnormalities are important obstetric complications that can significantly affect the pregnancy outcomes. They include abnormal placental implantations, attachments, functions, and separation. So early diagnosis through antenatal assessment and USG along with timely medical and nursing interventions, it helps to reduce the maternal and fetal morbidity and mortality rate. As nurses, we should assess the maternal vital signs, monitor the fetal well-being, observe for vaginal bleeding, providing the emotional support, preparing for emergency interventions when required, and educate the mother about the warning signs and importance of the regular antenatal care. So, the effective multidisciplinary management ensures safer outcomes for both the mother as well as for the fetus. Conclusion. The placental abnormalities are potentially life-threatening conditions that require early recognition and prompt management. So, a thorough understanding of their types, causes, clinical manifestations, diagnosis, and management enables the nurses to provide the safe, evidence-based, and compassionate care. Through vigilant assessment, timely intervention, patient education, and coordinated teamwork, nurse can contribute significantly to prevent the complications and to improve the maternal and neonatal health outcomes. Knowledge of placental abnormalities is therefore essential for every BSc nursing students for further nursing for future nursing professional. References. Thank you.